The first question that almost everybody asks is whether or not they need a colostomy. A colostomy is also sometimes called by patients a bag, meaning a location where the colon is brought out through the skin to collect the stool. Most colon cancer operations do not require a colostomy.
Early stage colon cancer, what we think of it as stage 1, 2, and 3. Stage 1s are cured most of the time by surgery, so we really don't give chemotherapy to them very often. Stage 2s are very controversial. Some might get some chemotherapy, some not. Stage 3s, most of the time, we give chemotherapy. No. Stage 3 is that the tumor has spread to the lymph nodes right nearby the tumor, but it's been removed, so the surgeon has taken it out. Some of those patients are cured by the surgeon, some are not. We give you chemotherapy in that stage to try and pick up some extra patients and cure those people.
I was terrified of chemotherapy. I was much more scared of it than surgery. The side effects that you're warned about, I could deal with. One thing, though, that really bothered me was the prospect of losing my hair. I know that that many women are scared of that, but I didn't lose a hair.
During your chemo, there's going to be days that you're not feeling so good, but there's going to be days that you are feeling good. Go with those moments. Go on that trip. Go have fun. Don't worry about the dishes. Don't worry about the laundry. Just go and enjoy yourself. It'll bring a smile to your face, helps the healing process. You'll feel a lot better.
Now, unfortunately, a lot of patients are found to have what's called metastatic disease. About 1/3 of all patients with colon cancer have this. This is where the seeds, if you will, have been sown to, say, the liver or the lungs, some other part of the body. Some of these patients actually can be cured with a surgical approach, going in, if you will, removing those weeds, digging them out by surgery, and some patients are cured by that. But unfortunately, most are not. And so what we do is treat those patients with our medicines. We use these medicines in various cocktails, collections of medicines, sometimes 1, 2, 3, sometimes even 4 medicines at a time. These medicines work to shrink down the tumor, and they can work in addition to keep it from growing back to a larger size. We use these medicines over 1, 2, 3, maybe many years of treatment to try and suppress the growth of the cancer and keep it from spreading. So most patients will be offered what we will call standard of care, but we want to do better. And so you may also be offered a clinical trial. Most of the clinical trials that are out there are trying to take this current standard and probably adding something to that, or maybe comparing the current standard to something else. Very rarely would the clinical trial involve a placebo. We certainly wouldn't remove a known active drug and then replace that with a placebo. So don't worry about that. Many clinical trials are what we call randomized clinical trials, where half the patients will receive, say, the standard therapy, and the other half will receive some new arrangement of the medicines. Don't be intimidated by that. Think of that as the ultimate second opinion, because these clinical trials are decided upon by all of us around the country and sometimes around the world. You're getting the most important question that we can ask about this disease to move the bar, to improve the outcome, to extend survival.